My name is Denise Chamblee. I look forward to sharing with you a short malpractice case today. The purpose of this particular case is to show how you, ophthalmology staff, can help make or break patient outcomes. I feel pretty confident that all of you listening sincerely want to help our patients. Even on your worst day in the office, I'm sure that none of you want to hurt someone. This case will be a loud and clear example of how a seemingly small oversight can cause patient harm. Thus the title, Harm to a Patient and a Horrible Outcome. Our patient in this case is a 46-year-old who had chronic tearing. Tearing was happening just all the time, and when the patient saw the ophthalmologist felt like a biopsy was needed. So the patient went into the operating room, and the physician took a biopsy and sent the specimen to pathology. A report came back from the pathologist, and that was faxed to the office, and the report was placed into the chart. The doctor, the ophthalmologist, never reviewed it and never signed off on it. There were some issues with the patient returning to the office for follow-up that was scheduled, but he ended up coming back about 4 months later. At that time, the area over the nasolacrimal system was still pretty inflamed and red, and the ophthalmologist was concerned. At that time, he reviewed the chart to see what had been going on and realized not only had it been 4 months since the patient had returned, but that now he saw the pathology report and realized that he never saw it soon after it was sent to the office. Well, the pathology report was pretty bad news. The report said that the tumor was malignant and was spreading. So that biopsy that he had never seen showed that this was a bad actor and had been spreading into the whole orbit and the eye. The patient then required a big surgery. This was an exenteration, a maxillectomy, parotidectomy, and a lymph node dissection. And what that basically means is that the entire contents of the orbit had to be removed, in addition to some lymph nodes and part of a bone. Well, I hate to have to show you this picture because it's pretty horrific, but I wanted you to understand the gravity of this situation. This photo is not actually the patient in our case, but shows you how devastating this particular surgery is, with the entire contents of the orbit needing to be removed. You can see on the picture on the right that the patient ended up with a prosthesis, which looks pretty good compared to what he started off with in the picture just post-operatively. Again, this is not our patient, but an example of how the patient looked for many months after the surgery, wearing a black patch. Obviously, this was just a devastating thing to the patient and to his family, and so sadly, his kids didn't even want him to take him to school. So one of the big questions in this case was, what would have happened if he would have had the biopsy report earlier? In other words, what would have happened if the ophthalmologist had seen that this biopsy showed that this tumor was spreading? Would this have helped the patient? Would it have led to a better outcome? And this case ended up settling because there was no way to prove that having this report earlier recognized would have not led to a better outcome. So there are a couple of important points in this case. The first one is, surely we all want to have a system to check test results. If we had had that in this case, we wouldn't even be presenting it right now. So if we had had a system in our office that made sure that any test that we did, in this case, it would have been the specimen which was sent to the pathologist, that we're following up on that, whether we get a report from the pathology lab or not, whether we saw that report or not, we need to pursue getting that and reviewing it. The second issue, obviously, is the fact that the report was received, but that the physician, the ophthalmologist, never saw it and never signed off on it. In our office, honestly, this could have been so many people. It could have been almost any one of our staff. It could have been the medical records person that got the fax and just filed it in the chart. It could have been that the report was attached to the chart, and when the patient checked in, the person checking him in just filed it into the chart to get it off the front of the chart. It could have been the technician that was trying to make sure that the paperwork was already on the chart, and just by an oversight by any one of those people didn't realize that the doctor hadn't checked off on that. Again, I'm really confident that every single one of you wants to help and that you all do this every single day for patients and for your physician. There's so much information coming at us all the time. And this case is really to emphasize that just one of those multitude of papers that come through could affect a patient's life. Your doctors depend on you each and every day, and you do extremely important work. And we can't thank you enough for everything you do to give patients the best care. And this is just an example of how important you really are to the patients and to the whole office and to your ophthalmologist. We always welcome your questions and encourage you to email us at riskmanagement@omic.com if we can be of any help.